Hello, I am AARP Vice President Bill Walsh, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you'd like to hear this telephone town hall in Spanish, please press *0 on your telephone keypad now. AARP is a nonprofit, nonpartisan member organization, and we have been working to promote the health and well being of Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. In many states, people 18 and older are now eligible for a vaccine, and access is improving across the country. More than 75% of people 65 and older have received at least one dose. While this is encouraging, many people are still struggling to find information on how to sign up. And at the same time, new variants of COVID-19 continue to spread, and misinformation is everywhere. Today, we'll hear from an impressive panel of experts about these issues and more. If you've participated in one of our teletown halls before, you know this is similar to a radio talk show, and you have the opportunity to ask your questions live. For those of you joining us on the phone, if you'd like to ask your question, press *3 on your telephone now to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you'd like to listen in Spanish, press *0 on your telephone keypad now. And if you're joining on Facebook or YouTube, you can post your question in the comments section. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion on the global coronavirus pandemic. We're talking with leading experts and taking your questions live. To ask your question, please press *3. And if you're joining on Facebook or YouTube, you can post your question in the comments. We have some outstanding guests joining us today, including representatives from the University of Maryland's Center for Vaccine Development and the National Association of City and County Health Officials. We'll also be joined by my AARP colleague, Jean Setzvin, who will help facilitate your calls today. This event is being recorded, and you can access the recording at aarp.org/coronavirus 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member, or if you're joining on Facebook or YouTube, place your question in the comments section. Now I'd like to welcome our guest. Kathleen Neuzil, MD, is the director of the Center for Vaccine Development and Global Health at the University of Maryland School of Medicine. She has decades of experience as a leading researcher on vaccines and was recently recognized by the Baltimore Sun as Marylander of the Year for her unprecedented leadership on COVID-19 vaccine research. Welcome to the program, Dr. Neuzil.
Thank you. I'm really delighted to be here and looking forward to the next hour.
All right. We're delighted to have you. I'd also like to welcome Adriane Casalotti. Adriane is the Chief of Government and Public Affairs at the National Association of County and City Health Officials. The organization represents 3,000 local health departments across the country. Welcome back to the program, Adriane.
Thanks for having me back. I'm excited.
All right, we are too. Let's get started with the discussion. And just a reminder, to ask your question, please press *3 on your telephone keypad or drop it in the comments section on Facebook or YouTube. Dr. Neuzil, let's start with you. You're among the world's foremost vaccine researchers. Why were the Johnson & Johnson and AstraZeneca vaccines suspended in the U.S. and Europe? And how do you think this will impact the availability of vaccines and hesitancy issues?
Yeah, you're really starting off with an easy question there.
We thought we'd dive right into the deep end.
No, I mean, these are very complex questions, and obviously safety is a top priority here and throughout the world. You know, I was involved in the clinical trials of both of these vaccines, and just to state that, you know, despite the fact that we did enroll 30 to 50,000 people in these trials, these are very rare events that are difficult to pick up. I will say that no safety was compromised as part of the trials. You know, most vaccine-associated side effects do appear within the first few weeks after vaccination, and that is exactly when we're seeing these rare thromboembolic events. So, in fact, it is because they are so rare and not because we didn't carefully follow participants that we did not pick them up in the clinical trials. These are severe blood clots occurring in unusual places, the cerebral venous sinuses, for example, associated with low platelet counts. And this is a very unusual combination of signs and symptoms. The fact that we could pick up these rare events says a lot about our safety systems in both the United States and Europe. And one of the main reasons for the initial pause in the United States is to make recipients of the vaccine and providers aware of this rare side effect and the fact that we treat it somewhat differently. And so a lot of the reason for the pause was that education about these rare side effects.
Mm. Okay. And do you think the pause will have an impact on the availability of vaccine for Americans? And, there's some folks who are simply hesitant to take a vaccine. Do you think it'll have any impact on those folks?
Yeah, it's a really good question. At the moment, we have been fortunate that we have plentiful supplies on a national level of the mRNA vaccines. Now, this does not mean that we have plentiful supplies at the local level, and Adriane may comment on this, but we are fortunate that the overall supply is good, and we have vaccines for people who want them. If the pause is removed quickly, then again, I think we will be in a fine situation. It certainly could affect vaccine hesitancy. Again, I think the emphasis should be on the robustness of our safety surveillance programs, that we were able to detect such a rare outcome, that the government officials acted on it very quickly and are continuing to deliberate. There's an advisory committee on immunization practices emergency meeting being held tomorrow. It's entirely public. The discussion will occur in a public and transparent way to further discuss these side effects and whether the pause should be lifted or continue.
Okay. Let me follow up on that. I mean, with the J&J distribution expected to resume at some point, what new, if any, steps should someone take to monitor themselves following a vaccine, and for how long?
Yeah, so that's a really great question. Most of the risk is in the first 2 to 3 weeks. So really, if you're beyond that period of time, this would be highly, highly unlikely to occur. Now, what you should be on the lookout for are severe headache. That is what might occur with cerebral venous sinus thrombosis. We know that much of the population routinely gets headaches on a regular basis, but this would really be a severe, unremitting headache. Certainly blurred vision, fainting, seizures. These blood clots can also occur in unusual veins in the abdomen, so severe pain in your stomach or abdomen or chest should certainly prompt you to visit a healthcare provider. And then we're more used to seeing clots in the legs or in the lungs, so certainly swelling or shortness of breath are other symptoms that might again yield somebody to contact a healthcare provider.
Okay. Thank you for that. That's very helpful. And you had talked a little bit before about how you were involved in the clinical trials for 2 of these vaccines, I believe. I wonder if you can help our audience understand how the development and the speed of the COVID vaccines differs from the norm for normal discovery and distribution of vaccines.
Yeah, it was really quite remarkable that we had vaccines under emergency use authorization and distribution within a year of recognizing this new pathogen. And that was really possible for a number of reasons. One was our investment in science and technology, the fact that we had funded programs here in the United States where we understood the first SARS coronavirus and a related coronavirus, the Middle Eastern Respiratory Syndrome, or MERS. We understood about the spike protein and how our body makes an immune response, and even how to make vaccines for those earlier pathogens. Now, those vaccines never made it to licensure because we really didn't have a business reason or public health reason to take them to licensure. But that foundational scientific work allowed scientists to work very quickly when we discovered this new virus and the genetic code. There was unprecedented resources put into these efforts, generally because vaccine development is very costly, hundreds of millions of dollars. We proceed in a very risk-averse manner. We want to be convinced that a vaccine is going to work before we move from one phase to the next. And the government investment really took a lot of that risk away and allowed us to work in parallel instead of in series. But I will make the comment that I made at the beginning. We really didn't compromise on safety. We moved in a very deliberate manner, starting with healthy, young and middle-aged adults, following them closely. We would vaccinate 5 or 6 people. We would wait a week, meticulously follow them and laboratory values. Then we would gradually vaccinate more people, and we would include larger numbers of people, older people, younger people, people with chronic diseases. So again, and then the very large nature of the studies was also a way to look at safety and to also be confident in the efficacy that these vaccines did work, not only in the youngest, healthiest people, but in the people most likely to get severe disease or die from COVID.
Okay. Thanks very much for that insider's point of view. Let's turn to you, Adriane. With the pause in the Johnson & Johnson vaccine, how have local health departments had to shift their strategy? I know this vaccine was one that was being distributed at some of these larger public facilities around the country.
Luckily, in some ways, proportionately, the majority of the vaccine available at this point and last week are the Pfizer and Moderna type, those mRNA vaccines that we were just talking about, which weren't affected by the pause. So that meant that relatively few individuals were impacted. That being said, the pause was recommended in the morning, and there were people who were set to have vaccination appointments that day with the J&J vaccine, as well as over the course of that week. So in some places, we saw the existing appointments for J&J shots could easily be filled by switching to one of the other products, the Pfizer or Moderna. But in others, it did mean that some appointments had to be canceled or postponed. For the general population, yes, you have to come back a second time, but in the grand scheme of things, not all that difficult once you can get things rescheduled. But that being said, the J&J vaccine has some unique properties about it that make it easier for certain groups and more attractive for certain patients. So from a provider perspective, we represent the local health departments across the country, and they were really focused on using them in ways for populations that are harder to reach. So folks like people who are experiencing homelessness, who you might not be able to get to come back within 3 or 4 weeks for their second dose, or it's harder to contact to keep up with those folks, folks who are homebound, people who work in certain industries like migrant farm workers or seafood workers who go out for long periods of time and they can't necessarily make it back on schedule for the next shot, or who are moving their where they live over the course of that time. And it was also more attractive to certain patients. So some folks who are concerned about taking time off of work to get 2 shots, we'd only have to do that 1 time. Frankly, some people who don't like needles were much more willing to go and get the 1 shot as opposed to the 2 shot. And then also for providers, the way that the shots are packaged, so the vials, the way that the vaccines come from the manufacturer to the place for administration also matters. So the J&J vaccine has properties where it really just needs a regular old refrigerator, and it comes in relatively small doses. So what you're able to do, if you don't see a lot of people, you can use up your vial of vaccine without wasting much. So there are some unique properties that made it really interesting preferred for certain locations or for certain populations.
Okay, and one of those populations you mentioned are folks who are homebound.
Mm-hmm.
What are local health departments doing to get the vaccine to people who are unable to leave their homes?
Yeah, so there's a lot of partnerships that we're hearing to try and best address folks who are homebound. And right now, every American over the age of 16 is eligible for the vaccine. And so wanting to make sure that we are serving and making sure that people get it as soon as they can. And so homebound individuals do pose some challenges, but there are a lot of ways that we're hearing that people are working together to make that work. So in some areas, we're hearing they're partnering with the area agencies on aging or Meals on Wheels to help identify folks who need access to the vaccine who can't go to a clinic or site to get vaccinated. In some communities, there are registries for the emergency management system, say places where there's a lot of wildfires or other natural disasters, where people can already be alert the locality that there are homebound individuals in certain areas. So you can look at that to find people who might need to be vaccinated in their homes. And then partnering with people like the EMS, professionals on the ambulances, fire departments, public health nurses, some medical reserve corps volunteers, nonprofit organizations, and community health centers and pharmacists to send people out to people's homes. So they are going, they're using their best mapping skills, right, to try and get to as many people as possible within the right amount of time, sending out a couple folks to people's homes to deliver the vaccine, give them all the information they need, wait with them for a little bit, and then move to the next household. And, J&J vaccine was particularly useful here, but we do have other communities that have been able to do this with the 2-dose mRNA vaccines, but obviously that means you're making all of these trips twice. And you have larger vials that you need to be supporting over the course of the day.
For folks who may be on the line today or loved ones of homebound people, do you have any advice for them about where to get information in their community?
Sure. If they still haven't been able to get an appointment, calling the local health department, calling the local area agency on aging will be a great way to connect into what some of these resources are. I will also say that they are focused not just on the homebound individual, but also a lot of times they will also vaccinate the caregivers who are there, because we want to make sure that everyone is getting vaccinated to keep us all safe. But reaching out in those ways can hopefully get you on the right list and get someone to your home.
Great. Thanks so much for that, Adriane. And just one other resource for our listeners, AARP has been creating state-by-state guides. You can find them on aarp.org/vaccine info. Those guides have toll-free numbers. They have information about where and how to sign up for a vaccine. So check that out if you need information. And as a reminder, to ask your question, please press *3. We're going to get to your live question shortly. But before we do, I'm going to bring in Nancy LeaMond. Nancy is the Executive Vice President and Chief Advocacy and Engagement Officer here at AARP. Welcome, Nancy.
Hi, Bill. How are you?
I'm very good. Thanks for being with us today. There's been a lot of action on COVID-19 on Capitol Hill over the last few months. What are the big things that our listeners should know about?
Well, it has been a very busy stretch with a lot of activity after AARP advocated for months for Congress to act to respond to the pandemic. We've seen some positive movement as last month the president signed the American Rescue Plan Act, and we were pleased it includes several AARP priorities: supporting expansion of COVID vaccine efforts expanding paid leave tax credits and the child tax credit, allowing more people to receive care in their homes and communities, increasing funding for food assistance and meal delivery programs, improving infection control in nursing homes, expanding unemployment insurance benefits for people who are out of work due to the pandemic, providing an expansion of subsidies that will make coverage under the Affordable Care Act more affordable and accessible for millions of Americans. This is so important. And delivering payments of $1,400 to millions of older adults, including people who receive benefits through Social Security, Veterans Affairs, and other programs. I should say it's a long list, and we're delighted it's a long list. AARP state offices across the country are also continuing this advocacy by working with governors and state legislatures to allocate the funding that was provided to states in ways that continue to address the needs of the 50 plus. Looking forward, Congress will soon begin working on an infrastructure plan, and AARP will continue to fight for the financial and health security of the 50 plus. This includes providing greater assistance to the nation's over 40 million family caregivers, making sure that as people age, they can remain in their homes and communities, and that people have access and can stay connected through high-speed internet. We'll also continue our work to lower prescription drug prices, which continue to cripple family budgets. It's a busy time on Capitol Hill, and AARP staff and volunteers will continue to work hard to make sure that needs of older adults across the country are a priority and that your voices are heard as we advocate on the issues that matter most to you.
Okay, thanks for that, Nancy. As the vaccine distribution process continues, where is AARP focusing its efforts?
Well, since the vaccine started to be rolled out, AARP has fought for older adults to be prioritized and to make the process easier for people. In every single state, AARP staff and volunteers have fought in state legislatures for transparency and reporting, and we've increased our efforts to provide people 50 plus with trusted information about vaccines. For example, and you mentioned this earlier, we've published online guides for every state explaining how to get the vaccine where you live, and you can find those at aarp.org/vaccineinfo. This work has paid off as more than 3/4 of people aged 65 and older now have received at least one dose of a COVID-19 vaccine. However, we know there's still a lot of work to do to ensure that everyone who wants a vaccine can get it, and people who may still have questions can get them answered. As the rollout continues, we will keep the pressure on our elected leaders and continue to provide critical information to our members, as we're doing today through this teletown hall. And we'll be focused on ensuring that older adults, particularly older adults of color, and those who are homebound have access. To stay up to date on all of these efforts, please visit our website, www, I always stumble on that, .aarp.org/coronavirus. Thanks a lot. Really appreciate the time to be with you.
All right. Thanks for joining us today, Nancy, and thanks for all the information. And before we turn to live questions, I want to address an important issue. We know that many of you are having challenges registering for vaccines in your state and community because many places require signups through online forums. And if you don't have access to a computer, this can be a real challenge. AARP wants to help. We've established an AARP vaccine registration team to try to assist in these cases. So if you're listening today and you don't have a computer and you can't register for a vaccine in your community because you don't have access to technology, please press 1 on your telephone right now to be added to a list to receive a phone call from an AARP staff member to help you out. Again, if you're listening today and you don't have access to a computer or the internet, and you can't register for a vaccine because of that, please press 1 to be added to a list to receive a phone call, and we will try to help you out. Thank you for that. And it is now time to address your questions about the coronavirus with Dr. Kathleen Neuzil and Adriane Casalotti. Please press *3 at any time on your telephone keypad to be connected with an AARP staff member to share your question live. Now I'd like to bring in my AARP colleague, Jean Setzvin, to help facilitate your calls. Welcome, Jean.
Thanks so much, Bill. Delighted to be here.
Okay, let's take our first question.
All right, our first question is coming from Grace in California.
Hey, Grace, welcome to the program. Hey, welcome. Go ahead with your question.
Yes, good morning. Thank you all for doing what you do. That's so fantastic. My question this morning is, how long after I have had my second shot should I go and get an antibody test? And what test do I ask for so I know that they're actually looking for the antibodies?
That's an interesting question. Dr. Neuzil, can you help out?
Yeah, we actually don't recommend that people get a post-vaccination antibody test, and part of it is for the reasons that you've just alluded to. The tests are really there for a different reason. The tests are primarily to diagnose COVID-19 and not to show that we have antibody from vaccination. We also don't know yet what we call a correlate of protection. In other words, is it antibody? Is it a T-cell response, which is a different immune response that protects you from vaccination? So the majority of people who receive this vaccination are protected and do very well with the immune response. And I think the listeners out there that may be worried because they're on immunosuppressive drugs, for example, or perhaps they had a transplant, should probably work through their doctor. But if you get a vaccine, you should, most of us are protected, but of course we should follow CDC guidelines in terms of, continuing to wear masks and socializing in smaller groups.
Okay, very good. Jean, who is our next caller?
Our next caller is Garrett from Florida.
Hey, Garrett, welcome to the program. Go ahead with your question. Hey, Garrett, go ahead with your question. Okay, who is our next caller?
Our next caller is Caroline from Illinois.
Hey, Caroline, welcome to the show. Go ahead with your question.
Thank you. My question is, I've had my second shot on the 15th, so it's been about a week. I've been told that I need to stay away from contacts for another week. Is that really true?
Stay away from, what did you say? I'm sorry, can you repeat that?
I've been told that I need to wait 2 weeks before I do any socializing with my friends.
Okay. Dr. Neuzil, what is the latest guidance for folks who have received their full regimen of vaccine?
Yeah, so people are considered vaccinated 2 weeks after their second dose in whatever series they receive. So that would be, or 2 weeks after they're fully vaccinated, which would be 2 doses for the Moderna or Pfizer vaccines and 2 weeks for the Johnson & Johnson vaccine, which is the single dose vaccine. While there certainly are people who are likely protected before then. We need to understand that this guidance is national guidance. I would also ask people for patience. We've all waited a long time to get to the point where we can start to socialize and have a little bit more freedom. So waiting that extra week is worth it just to be sure you are fully protected.
Okay, Dr. Neuzil, thank you very much. And thanks, Caroline, for that question. I understand we have a question on Facebook.
Yes, we do have some questions coming in from YouTube and Facebook. And this one is from Selena, and she's asking, has there been equitable distribution of vaccines both in the U.S. as well as the world? And if not, what's being done? This will not be contained unless everybody has a chance of getting a vaccine.
Equitable distribution. Adriane, can you address that?
Do my best. I mean, I can talk about the United States and then globally. Actually, I'll do globally first. So globally, there are still many countries that are not yet having access to the vaccines, and the vaccines that are authorized in the United States for use, Pfizer, Moderna, and Johnson & Johnson, though that one is on pause, as we've talked about, are not necessarily the same vaccines that are authorized for use in other countries as well. It is a big issue of making sure that that the richer countries in the world, frankly, are getting vaccinated, but that everyone is getting vaccinated, because not every country has the ability to make some of the deals with pharmaceutical companies the ways that ours have. And in making those deals with what was spoke about earlier, about how much investment was put into the creation of these vaccines and the development and the production of the vaccines, and doing so quickly, that also meant that we had deals in place that said now those vaccines have to come to the United States first. So there's definitely a push, and it will continue to be a long time before, as a globe, we are all vaccinated with with vaccines that are to the same standards, especially as what we have here in the United States. And that's why you'll continue to see CDC guidance recommending against travel globally, where there are different variants and different levels of vaccination, as well as different the efficacy of the vaccines that are being used in different countries also vary. Nationally, we have really the federal government has been releasing the vaccines based on population, overall population, and so that has led to some areas where there's been challenges, because people are not just being vaccinated where they physically live, but also sometimes where they work, and that can cross barriers. I was in Washington, D.C., and that's a huge issue between Maryland, Virginia, and Washington, D.C., for example. Once the vaccines are sent out to the different states, about, based on population, that who's getting the vaccine and the uptake of that vaccine, so who it's being administered to, equitable uptake is a huge issue, and it continues to be so. We know that COVID has not impacted all populations evenly. There are huge existing health disparities and inequities that COVID's really exploited and really shown us very clearly how it impacts across the country. And so there have had to be real concerted efforts to try and make sure that vaccines are getting to those populations that are disproportionately impacted by COVID when they might not be the easiest. So we know in some local health departments, we hear, okay, our pre-registration line is full. We have so many people who want vaccine. But when we look at it, it's not really representative of our whole community. It's really folks who have better access to internet, who can, are working from home, who can take off disproportionately, not representing the more minority populations. And so there have to be concerted efforts to really reach in and make sure that we're doing so in an equitable way. A lot of communities have been working to partner with community-based organizations and other nonprofits that work in particular parts of their region to make sure that you're making connections to all the people who still need access to vaccines. But it's definitely a focus that people have, and that we have to continue to have a focus on, because it's very easy to lose some of that nuance when we're just looking at national numbers.
Yeah. Okay. Thanks for that. Let's go back to the lines. Who is our next caller, Jean?
Our next caller is Jay from Massachusetts.
Hey, Jay. Welcome to the program. Go ahead with your question.
Good afternoon. Hey, I love your calls. This is probably my 6th or 7th one I've listened to over the last year. And
great.
I think it's a great service that you guys are doing. My question for the team here is, a year from now, or a year and a half from now, or 2 years from now, do you feel that we are going to need to still worry about COVID-19 and vaccines and like a flu shot every year? We're going to have to get this shot every year for COVID, or is this going to go away?
Yeah, that's a great question, Jay. Dr. Neuzil, what do you think about that? Booster shots, and will we be concerned about COVID-19 in April of 2022?
Yeah, it is a really great question. And I think when this virus first appeared, we were hoping it would be more like SARS-1, which was as awful as it was, disappeared and hasn't returned. That is looking less and less likely as this virus continues to infect humans, and also as it's shown its ability to adapt to humans. You know, it has adapted very, very well to this new species that it infected. So we do expect SARS-CoV-2 to likely be around. You know, we are hoping that it is around as more of a nuisance virus, but I believe we do have to prepare for the fact that it will be similar to influenza, and we may need booster doses of this vaccine, whether it's yearly, whether it's every few years. I think it's a little bit too soon to say. I do, however, think that it is likely to be with us because how well, again, it has adapted to humans, how easily it can spread. We are likely, this virus will become part of the other respiratory viruses that infect the human population on a yearly basis.
Yeah. Well, thanks for that, Dr. Neuzil. We were hoping for some more optimistic news, but we appreciate the facts and the realism. All right, well, let's go back to the line. Who do we have next, Jean?
Our next caller is Terry from Michigan.
Hey, Terry, welcome to the program. Go ahead with your question.
Yes, thank you for taking my call. In Michigan, we've had about 6 million people receive their vaccines, and when we've had information on this herd immunity, it's always been told that if we had 70% of the country, that we would start seeing some evidence of this herd immunity. Well, Michigan has like 60% of their people vaccinated, and we're seeing the reverse. What we're seeing is a surge with the infections going from 6,000 to 8,000 a day. And I was just wondering, the one explanation that the governor gives is that we did such a good job early on in protecting our state that with the masking and social distancing, that there are more people vulnerable in our state. I was just wondering what the experts think about the surge in Michigan.
That's interesting, a surge at a time when we're also seeing a surge in vaccinations. Maybe both of our experts want to weigh in on that. Let's start with you, Adriane. Do you have any thoughts on that?
Yeah, so thanks for the question. And I think this is where it really gets into the importance of us having good public health data. So if you remember, it was only about a week ago that now all people over the age of 16 are eligible to be vaccinated. But before then, it was really being done by specific populations, so healthcare workers, teachers in some areas, but then also working down in age. Well, what we're seeing in the Michigan case numbers is a lot of outbreaks that are happening in kids, in young adults. So you do see fewer cases in the older population, and those are the populations that were most likely to be vaccinated and most likely to be fully vaccinated earlier. And so it really shows the importance of vaccination, first of all, of everyone getting vaccinated and making sure their loved ones also get vaccinated if they're eligible to do so, but then also some of the other mitigation measures that still need to be in place, whether that be masking and social distancing. They've found that there are certain areas where there's lots of outbreaks. For example, youth sports, youth wrestling, youth basketball. These are places where it makes sense as to why the virus spreads very quickly there. But even with vaccines, there are still certain things that are going to be more risky, especially given that folks under the age of 16 cannot be vaccinated at this point.
Mm. And Dr. Neuzil, I don't know if you want to weigh in on this as well. I was going to follow up with a question about, what you want every American to know about vaccines. I wonder if you could wrap all that together. Do you see an explanation for the Michigan surge? And are there things about the vaccines that you want Americans to know?
Yeah, I think Adriane explained it very well, that when we talk about vaccine coverage and talk about transmission of the virus, you know, this is occurring in real life and pockets, right? It's not evenly distributed. We know that older persons have the highest vaccination rates, and they have very nicely followed non-pharmaceutical guidelines of masking and social distancing. We don't have a vaccine for children yet. That point has been made. And we didn't have vaccine for young adults who were more likely to be circulating in society. Even something like measles, that's very rare in the U.S., where our vaccination rates may be 99%, if that 1% of unvaccinated are all in the same place, you're going to have a sizable outbreak. So again, it's sometimes the numbers can be a little bit misleading there. I think that this really emphasizes a point about infectious diseases and vaccines in general. You're not only doing it to protect yourself, you're doing it to protect others. And this is why we were telling people, you know, get the first vaccine you can get. I am certainly protected if I get a vaccine. I am more protected if everybody around me also gets a vaccine.
That's a great point. That's something we all need to remember, even as vaccines become more available. Adriane, I'd like to turn to you. You know, access to information has been a challenge for many people throughout the distribution process. You know, we're several months into it now, but we're at an important moment. What are some of the early lessons learned about communication and engagement that's going to help us with vaccine distribution as the process continues? This has really been like a case study in public health communications.
For sure. And actually, let me just one thing back to the caller's last question. The other thing that we haven't talked much about are variants. So there are some variants to the virus that kids tend to be more susceptible towards getting, and that tend to spread a little bit easier. So just really the vaccines do work against these variants, but really just reemphasizes that anyone who can be vaccinated really needs to be vaccinated to help protect some of the folks who can't in our population. But that conversation about how do we talk about all of these things, right? Public health has not done a great job of having phrases in like bumper sticker size chunks. And yet, in some ways, I absolutely wish we could, you know, we've been having challenges around the public communication for coronavirus since the beginning, since before we even had a name for it. And yet, you know, there are some really focused efforts to try and help figure out both the right messages, but also the right messengers. You know, public health communication is hard, it's nuanced, and we really do need to make sure that folks are hearing the same messages, that they are clear, but you're hearing them from all levels and all sectors. So if you hear something different from your local health official and your primary care provider, the person at the pharmacy, and the president, and the head of the Centers for Disease Control and Prevention, it's super complicated. And these are already complicated messages. So how do we streamline this information top to bottom? We also, public health communication is challenging because we're learning more about the virus every day. And so having messages that evolve does not necessarily mean that we weren't telling the truth 2 months ago, 3 months ago, 6 months ago. It's that we've learned more and now we know what to do and have better recommendations to move forward. You know, that's work that is being done. I think there's also, people are right to have questions. And when you're in the middle of a pandemic, sometimes we don't make the space for people to ask them, to really hear the information, both to answer the questions that people have, but also what's unique for their situation, for the situation of their family, of their loved ones. And the more that we can open those lines of communication so that people can ask those questions and get answers in a factual way that really respect people thinking critically about this is important. And I think that's one of the ways, you know, local health departments have been trying to partner with faith-based organizations, community-based organizations, and others to help make sure that where they're the right messenger, they're there. But otherwise, you know, who are the right messengers Do they have the information that they need? And, where can we make the space for people to have these one-on-one conversations?
Right. All right. Well, let's get to some of those questions right now. This is time for you to pose your questions to Dr. Kathleen Neuzil and Adriane Casalotti. As a reminder, press *3 at any time on your telephone keypad to be connected with an AARP staff member. Jean, who do we have next on the line?
We're going to go to a YouTube question, and Maddie on YouTube is asking, if you have to get a booster shot next year, do you have to get the same vaccine as the same manufacturer from the first shot that you received?
Oh, that's interesting. Dr. Neuzil.
Yes, it's a great question, and we in the research field are trying to stay ahead of the practical public health questions that will emerge. So we are actually looking at that now on whether the booster dose, there are companies, Pfizer and Moderna, who are already looking at booster doses with their own vaccine, and then the NIH will be sponsoring a trial that looks at booster doses if we mix and match with different vaccines. And similarly in the United Kingdom, because they have slightly different vaccines that are approved for use there, they are also looking at these mix and match booster schedules, because we may have additional vaccines that are authorized certainly by the fall or later if we should recommend a booster dose. So I would say stay tuned for the answer to that question.
Okay. Thank you very much. Jean, who is our next caller?
Another question coming from Facebook from Adele, and she's asking, will you please tell us a little more about the current air travel guidelines for people who are fully vaccinated?
People are already thinking about getting back on airplanes. Okay, Adriane, what can you tell us about that?
So I can tell you a little bit, and then I can point you to where all that information is. So for domestic travel, for fully vaccinated travelers, they can, you no longer need to get tested before or after travel unless your destination requires it. And fully vaccinated travelers should not need to self-quarantine the way that someone who is not fully vaccinated would need to when they get to a new place. That being said, if going on an airplane and, anytime you're really in public, you need to be wearing a mask over your nose and mouth, staying 6 feet apart when you can and avoid crowds, and washing your hands often and using hand sanitizer. That's for domestic travel. CDC is really recommending delaying travel domestically, even on airlines, until you are fully vaccinated, because it does increase your chance of getting and spreading COVID-19. And they are continuing to update those guidelines as we get more information. For international travel, CDC is saying that, yes, you're less likely to get and spread COVID-19, but international travel poses additional risks for even fully vaccinated travelers. So they are still recommending delaying international travel until you are fully vaccinated, but even if you are fully vaccinated, that avoiding it if possible. There are different recommendations for different countries. You may not have to get tested anymore or quarantining, but their destination might require testing and quarantining. And again, I mentioned this a little bit before. There are different variants that are spreading in other places that you're still protected by, but may make you a little bit more susceptible to. There's also different levels of vaccination in other countries, as well as the vaccines that other countries are using. Some of them are not as strong as the vaccines that we have authorized in the United States. So there is still a risk there. And so the international and the domestic flying guidelines are different. But both of these are very prominent on the CDC website. So if you do have access to the internet, searching for airline travel, COVID-19 CDC gets you to all of this information.
Yeah. Very good. Thank you for that, Adriane. CDC.gov has a great deal of information on travel and other things related to COVID, as does the AARP website. If you go to aarp.org/travel, we have a lot of information on the latest CDC guidelines. We also have tips if you are planning a trip, how to do that safely. Jean, who is our next caller?
Our next caller is Iris from New York.
Hey, Iris, welcome to the program. Go ahead with your question.
Thank you. I had the Moderna vaccine in February and March. I have also had shingles twice in my life, and I have put off, and also because of lack of availability, the shingles vaccine. Would this be the wrong time to challenge my body, my immune system? Would it be overload if I considered taking the shingles vaccine at this time?
Right. Let's ask Dr. Neuzil. Dr. Neuzil, what are your thoughts on that?
Yeah, that's a great question, and actually, we've had these sorts of questions a lot. You should absolutely take the shingles vaccine. As you know, if you have had this twice, it's a very serious, painful illness. The vaccine is an excellent vaccine in terms of efficacy. It does cause some side effects, and those side effects can actually be similar to the coronavirus vaccine. But if it's been more than 14 days, the CDC tells us, and in fact from the trials, we used about that same date range, that it is safe to take the shingles vaccine. So if your last vaccine was in March, then yes, you are cleared for the shingles vaccine, and I would recommend it.
Okay. Thank you for that, Dr. Neuzil. Jean, who is our next caller?
Our next caller is Richard from Ohio.
Hey, Richard. Welcome to the program. Go ahead with your question.
My question is that I have heard conflicting information about variants. I am fully vaccinated, but some sources say I could still catch COVID from one of the variants, either the South African or UK variant. Other sources seem to say that the vaccine, if it didn't prevent it, would at least make it relatively harmless.
May I ask which vaccine you received?
Moderna.
Moderna. Okay. Adriane Casalotti, I wonder if you could address Richard's question. How effective are the vaccines against these variants we're seeing?
Sure. I'll take a stab at it, and then I think Dr. Neuzil might have more specifics from the research side, perhaps. This is exactly the public health communication challenges we have. So from what we know, the vaccines are effective. The vaccines that are authorized in the United States are effective against the different variants. That being said, vaccines have different levels of how effective they are against different the diseases they're trying to prevent. So these vaccines in general are very, very effective at blocking COVID and the wild type, so the type it was really identified and built to protect against. They might be slightly less effective against the variants for catching them, for getting infected, but they're still effective against them a great deal. It's just not as high. And also, when we look at the vaccines were looked at for not necessarily are you infected, are you not infected, but are you infected and have severe disease? Are you infected and have going to the hospital? Are you infected and what that impacts on whether or not would someone die? And so the ways that the vaccines work is really we're keeping people alive. We're trying to reduce hospitalizations and severe disease, but there is still a chance that you can get infected. And so we're learning more about the variants. We're learning more about the way that the vaccines interact with the variants. But in general, getting vaccinated helps you to not get infected by or have severe complications from the variants.
Right. And I suppose it underscores the continued CDC guidelines that even if you are vaccinated, to continue to take precautions in public with masks and social distancing. Dr. Neuzil, did you want to weigh in on Richard's question?
Yeah, just to say, Adriane, you really summarized it beautifully. You know, it takes a little more antibody in the test tube to work against these variants. But most of us who get these vaccines make a little more antibody than we have to make. And as the data are rolling in, and they're coming in more slowly because we tested these vaccines in the United States at a time when the variants weren't common in the United States. So we're starting to get data from other countries, and it's really very encouraging that these vaccines do protect against the variants and particularly against severe disease caused by the variants.
Okay. Thank you for that, Dr. Neuzil, and thanks to Adriane as well. Jean, who is our next caller?
Our next caller is Mary from California.
Hey, Mary, welcome to the program. Go ahead with your question.
Okay, my question is very simple. I was asked questions, and I wanted to ask you of this question. Even after you get the vaccines, I've had the J&J, the Johnson & Johnson vaccine, which is only one, and we follow up. I'm asking how many days or how many years do we constantly follow up on these vaccines? Because I'm one of the persons that usually get a strain shot, and I'll break out. So, but this one I didn't break out or anything, so I'm trying to see the follow-up dates. That's all. Is it a year or two or what?
Booster shot is what you're talking about, right?
Yeah, if it's because they said that we don't have to have it, and I'm just trying to find out, is that,
Yeah, well, let's ask. Yeah, no, that's a good question. Let's ask Dr. Neuzil. We were talking about boosters before. I think we don't entirely know yet. Is that right, Dr. Neuzil?
Yeah, that's right. So Mary, you've had the single dose shot, and that is considered to be fully protective at this stage. You know, the clinical trials and the people in the clinical trials are about 6 to 8 months ahead of the rest of us in terms of when they receive their vaccine. And we're following those people who got the vaccine early on very carefully to understand duration of immunity. So right now, there is no recommendation for booster doses. And again, because we have these trial participants who are continued to be followed, we will know and we will have a signal if booster doses are necessary before it would have to be rolled out to the general public.
Right. What about the J&J vaccine, though, Dr. Neuzil? How long after someone's gotten that are they considered in the clear, particularly for the blood clots and potentially other side effects?
Yeah, so what the CDC and the FDA say is it's the 2 to 3 week period after receiving that vaccine that is the risk period for this particular side effect. So if you're beyond that 3 week period, then we just haven't seen cases beyond that period.
Okay, thanks for that. And Mary, I hope that answers your question. Dr. Neuzil and Adriane, I wonder if you have any closing thoughts or recommendations that our listeners should understand most from the conversation today. Why don't we start with you, Adriane?
Sure. I think, first of all, I just love this event, and I'm so glad that so many people are listening and getting their questions answered. And keep asking these great questions, because the more you know, the more you can make good choices for you and your family, but also spread the word to your friends and neighbors. I think the key thing that we're focused on now is making sure that everyone who's eligible, meaning everyone over the age of 16, goes out and gets their shot. If you are fully vaccinated yourself, call your kids, call your grandkids, harass the neighbor or the person who mows your lawn, whatever that may be. Make sure that they know that they too need to get vaccinated. And if there's any way to help them, connect them to do so. We're really all in this together. And those of us who are vaccinated are the best messengers to others about why they should go and do that themselves. So thanks again for having me, and let's spread the word on vaccines.
All right, Adriane, thanks so much. Dr. Neuzil, any closing thoughts or recommendations today?
Yeah, I just want to also add that this has really been a terrific hour. You have a very educated audience. These were great questions, challenging questions, and I appreciate being on. I think I can't say it better than Adriane. You know, we really need everybody vaccinated. And as we talk about these variants, for example, the more people that are vaccinated, the fewer variants that will emerge. So it's all an interplay between the virus and the population. And really, you know, our best weapon here is the vaccine.
All right. Thank you both. And you're right about our membership. Only the smartest people join AARP. This has been a really informative discussion. Thanks to each of you for answering our questions. And thank you, our AARP members, volunteers, and listeners for participating in the discussion. AARP is a nonprofit, nonpartisan member organization. We have been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others while taking care of themselves. All of the resources referenced today, including a recording of today's Q&A event, can be found at aarp.org/coronavirus, beginning tomorrow, April 23rd. Again, that web address is aarp.org/coronavirus. Go there if your question was not addressed, and you will find the latest updates, as well as information created specifically for older adults and family caregivers. We hope you've learned something today that can help keep you and your loved ones healthy. Please tune in May 6th at 1 p.m. for another live event answering your questions about the coronavirus. Until then, thank you and have a great day. This concludes our call.